The board last month at its meeting endorsed the plan to pursue an affiliation with Dartmouth. It was something that the medical staff is on board with, very much so, and the board's feeling is that it would be a real benefit to the community in the sense that what it's going to do right off the bat, we hope, is ensure that we're going to have our service lines, our medical service lines, strengthened and sustained over the next 15 to 20 years anyway, if this works the way we're hoping. And it's also a source for recruitment of physicians as time goes on.
Across the country, it's not uncommon. You're seeing more and more of the smaller institutions looking to partner and link up with larger systems. In our case, we think it's going to play a major role in helping us to recruit and retain top quality physicians. And I won't have to tell you, that's one of our biggest challenges in rural Vermont. The recruitment and retention of physicians and other clinicians is something that's an everyday challenge, and Mark will talk a little bit more about that. I think it's going to also help us to expand our local healthcare options. We'll get into a little more detail on that. And also, one of the biggest preparations, and something you guys have been writing about a lot, is the healthcare reform, what it means down the road in terms of preparation for probably a single-payer system that will come to Vermont. The partnership is not a merger. I'm a product of a merger. I've been through it before. This is really all about an academic medical center working with a community health system, and to come up with systems that make sense for both organizations. This is not about them taking us over. We retain our corporate status as SVHC. We retain our operating license. This is not about reductions in force, layoffs. They're 2 hours from us, probably 100 miles. It's how we can better provide services together. We think it's a great opportunity for mutual benefit. We think that as we look at this, and this will take time for us to unfold and look for all the opportunities, but access to best practice in the healthcare setting, the potential for clinical research, the potential for clinical drug trials, the ability for us to work together electronically from a medical record. All these things have opportunities in terms of us working closely together.
Physicians now are very discriminating in terms of looking for everything for the perfect job, and because there's a growing shortage, I see this problem doing nothing but getting more acute. So having that affiliation with an academic partner, I think, would be a real drawing card.
And how would that work as far as a draw?
So when you recruit, some of the people that you're recruiting are coming right out of their residency and fellowship. So they're coming from an academic environment. So leaving an academic environment and going to a rural hospital, what they think they're going to lose is that learning environment. Mm-hmm. So if we can tie into the academic environment up at Dartmouth, it's very helpful. So I'll give you an example. One of our oncologists here, Dr. Howard, came from Dana-Farber. He was on the faculty of Dana-Farber. So he, 6 years as a faculty member at Dana-Farber, extremely well-trained physician. He misses that. So he goes up to Dartmouth twice a month and he participates in tumor boards up there. Now guess what? We've got 2 oncologists. They have 36. We have 1 tumor board. They have 14 different tumor boards. So his ability to go up there and learn about what's new in lymphoma, or learn what's new in breast cancer, learn what's new in lung cancer is really a marvelous opportunity. And we see that other physicians would like to have the same opportunity.
Would we start seeing a lot more residencies?